Great chiropractors and physical therapists are under constant pressure of declining insurance reimbursements and long hours. But did you know there's a way to double your profit without working more? By building a gym onto your practice, you can earn more income, stabilize your business, and be a hero to your family, patients, and team. It's a big undertaking with a huge reward. Dr. Josh Satterley has done it, changed his life, and now wants to help you do the same. Welcome to Clinic Gym Radio.
Hey everybody, welcome to another episode of Clinic Gym Radio. I am your host, Dr. Josh Satterley, and I am honored to be on today with the president, not the president, but a president, Dr. Bill Morgan. Bill, how are you today?
Oh, very good, Josh. Thank you so very much for having me today.
Yeah, my pleasure. Now, can you explain to everybody why I called you a president and maybe a little bit of where you're calling in from?
Well, I'm the president of Parker University. And I'm calling from my office here in Dallas, Texas.
Fantastic. Well, that is the home of Parker University. You guys sure have a global reach, I would say, in the world of chiropractic. But you have an interesting path as to becoming the president of Parker University. And it could go on for hours, but do you think you could give us just the listeners maybe a 1 or 2 minute little synopsis of how you ended up as president?
Sure. As they say, I have a non-traditional pathway. I'm not an academic. When I meat with the other university presidents in Texas, that's what they'll call it. But it's not a downside. It's different. There's different skill sets. You know, for me, I look at it. I know what a chiropractor should look like, a successful chiropractor, and I won't say I'm not encumbered by the constraints of being an academic, because the academics really have a strong, their strengths. Like, you don't want me being a technique instructor or teaching biochemistry. I couldn't do it. My path is not traditional. I was in private practice for 13 years in California. And then I'd worked in a couple of hospitals and hospital systems in California. So when the Navy was putting their first tertiary care facility together at Bethesda Naval Hospital, they put a call looking for chiropractors. And I had been in the Navy and had started hospital-based chiropractic care a few times. So I was hired. And from there, our hospital was then joined with Walter Reed to make this mega hospital. And while I was there, I was treating members of Congress. I had a practice in the Capitol building 2 days a week for 16 years. I would take care of the President of the United States on call. The Chairman of the Joint Chiefs on call. I would travel with the Joint Chiefs, and also took care of the Naval Academy football team. I was on the board of trustees for Palmer College of Chiropractic for 10 years. So I kind of learned the high-level management of a university, but I was also a professor for New York Chiropractic College and several other chiropractic colleges and one medical school. So that background, along with having my own seminar business, I don't know if you heard, but Parker's kind of into this seminar thing, kind of prepared me for the college here.
So you worked in every branch of government, and then you worked in every branch of chiropractic you tried to get into, huh?
Pretty much. And I was involved with the largest research study ever conducted for chiropractic. I helped with Christine Gertz put together the sites for this multi-site program over several years, 4 years, and we're soon going to publish the results of that study. But I've been in research, done scholarly activity, taught. Pretty much tried to have a broad. My resume wanted to be broad, and there's something I call the master clinician model, where you're a patient advocate, you're also the educator, you're a master clinician, you should be a master adjuster, you should be an educator. All the full package can become the master clinician. If you emphasize just one thing, you become good at that one thing. Could be research, clinical chiropractic, but to be a master, you have to broaden yourself out over a course of several disciplines.
Wow. Well, you certainly have done so much in a relatively short amount of time. So this is going to be a great interview. I'm very excited. Let me ask you this. First question. What's the craziest place you've ever delivered a chiropractic treatment?
Oh, let's see. White House. When I first graduated, I took 3 months and went to Liberia, West Africa. So I'm backpacking to Liberia.
Where else would you go?
Oh yeah, no kidding, right? So jungle huts. I've adjusted people there. I've adjusted people. Naval Academy football team. I remember a few years back we had the Army Navy game. It was pouring, snow and sleet, and I had icicles hanging off my adjusting table. So adjusting football players in the middle of a snowstorm in Baltimore for an Army Navy game, in the White House, in the Capitol, in the Pentagon. Those are other places, and those are pretty crazy places to give adjustments.
Well, once you were in Liberia, you should your memoirs will be titled "From a Mud House to the White House," right? Delivered care good. Everywhere. Yeah. So, well, that's awesome. You certainly have a storied career, but the reason that I wanted to interview you was you're really on the front lines of some advances that are going on within the profession, specifically at the student level. And I want to dive into that. So you are the big cheese over there at Parker University, and you guys have recently made an addition into the world of fitness. Can you kind of explain a little bit of what's going on over there?
Yeah, we're calling it ParkerFit. We just created a 7,200 square foot functional fitness facility here at Parker. Bumper plates, Olympic lifting platforms, sleds, box jumps. And this is in addition to our already very well equipped gym that's more traditional that you'd see at hopefully any other university. That gym has, barbells, dumbbells, kettlebells. But our functional fitness has a lot of, different things that are more functional. As you know, back in the 70s, the fitness culture was hijacked by the bodybuilding culture of sets and reps and isolation exercises, where it really almost promotes dysfunction in our bodies and dysfunction. And what we want to do is emphasize how our bodies were meant to be used, not isolation curls or leg extensions, but, squatting and lunging motions and pushing and pulling and rope and use our body as it would be used in nature. And that's what our new functional fitness facility looks like. And with it, we really have delved into functional assessment and, helping people to live their life as if, basically work out that's going to support your lifestyle.
I love it. I absolutely love it because, the point of this podcast is to encourage chiropractors who have a successful practice to add a gym because it is such a perfect fit with the care you deliver. And it's just a perfect follow-up for those people once they're discharged from care, maintain their function through exercise. And it sounds like you guys are delivering that message to the students, right? Let's look at some functional assessment processes. Let's look for some functional training processes, and then put that into basically the idea of when these young students graduate. Well, they're not all young, but when these students graduate, they're already looking at fitness as a integrative. I almost want to say an integrative therapy, just like you would look at soft tissue skills or manipulation skills. This is an integrated piece of what we deliver our clients, right?
Oh, truly. And we look at the patients we're looking at. Let's say we have a woman or a man who's 85 years old, and they're looking at extending their ability to live independently. If they cannot perform a squat, rise from a squat, if they can't get off the commode, they might have to go into assisted living. The strength we give them, the coaching we give them, the treatments we give them, the adjustments we give them may give them 5 more years, 10 more years of independent living. That is you're giving back their life and their lifestyle. And as we look at function, like you might have somebody do a squat for you, simple functional screening, and they may be all cattywampus, their pelvis is twisting over all over the place. And it looks, oh my gosh, this guy's got SI problems or spinal problems. But the keen eye, the eye that looks, wait a sec, that person doesn't have dorsal flexion of their ankle. They've lost ankle mobility. I adjust their ankle. They can do a squat. They can rise from the toilet. They can live independently.
Yeah, it's huge. It's huge what you're providing them at that point. I mean, independence is worth more than anything to almost everybody, right? I mean, if there's nobody that wants to rely on someone else for daily simple activities, so
no.
I think it's fantastic that you guys are integrating that. Now, let me ask, how did that all develop? I mean, there's a lot of chiropractic colleges, and yours is the only one I'm hearing adding in the fitness certainly at the level you're doing it. I mean, they all have gyms for their students, but you're talking about something else. How did this come about?
Well, as you know, I came from Walter Reed National Military Medical Center. I was in a rehab, a basically physical medicine rehab department. We were the manual medicine for physical medicine, chiropractic. So we had a highly integrated program, very progressive functional gym. So people would come back from the wars with some significant injuries. So, and as we're trying to get them to be able to do activities of daily living, riding a bicycle, picking up a wheelbarrow and pushing a broom, we would go and we would work together. And I would do spinal adjustments, but also, the physical therapist would call me over and, hey, this person can't dorsal flex his foot. I'd go over and they can't do a certain activity. I'd adjust their foot. And we would look at them. We do a functional assessment at chiropractic to the exercises, because the end goal is not just independence, but having a lifestyle where you have a fulfillment of your life. And we would have these, I've seen what can happen with amputees, with severely wounded folks, when you combine chiropractic with exercise. It's magnificent. Plus, what is it they want to do? It's, you've heard the phrase, if you take a picture of a phone, it doesn't tell you if the phone works or not. You actually have to see the function of it. And when we emphasize the function of the human body rather than static listings, you actually go to a whole new dimension in chiropractic.
Preach on, brother. Preach on. I 100% agree with that. Yep. And so when you got over to Parker, were you the driving force behind the idea of fitness? Was it already in motion? Okay. So it was you.
I will say this whole place is full of, we have young, healthy people all over the place who are already working out. A lot of them were spending their own money to go out to CrossFit gyms and such. And we have students here who've been high-level competitors in CrossFit. Also, we've got former Olympic athletes and professional athletes here. So, putting this together, we're basically a gym that emphasizes the form and function and structure.
Nice. Okay.
So it was just add water pretty much. They were already here, and this type of gym was just pretty exciting for everybody.
Yeah. Well, usually this is a horrible pun to use with you, but usually it takes an act of Congress to get something like that off the ground. You like that? That was pretty good, right?
So that was good. I liked it.
So it usually takes an act of Congress to get something like that off the ground at a university. But you seem to be a guy that likes to move fast and break things along the way. In the sense, that's Mark Zuckerberg's thing, right? Move fast, break things.
Fail forward, fail fast, fail forward, fail often.
How long did it take you guys to from the time you decided to start it? How long did it take to actually open the facility?
Well, it took 1 year and 2 weeks. By that we actually probably did in 10 or 12 months, but it's basically, Admiral Mullen, who I know has a phrase that when he became an admiral, he was the chairman of the Joint Chiefs, but when he became admiral, he said he got a note from someone and it said essentially this: congratulations, from now on you'll be well fed and you'll never hear the truth again. So the deal is
that's awesome.
when you're the boss, people want to tell you how great things are going, but I think they wanted to make it too good. And I'm like, guys, we're going to take an empty warehouse and we're going to convert it into an empty warehouse. So once they got the idea that we took this empty warehouse and we put mats on it, we painted, we fixed it up nicely, but it's really, most functional gyms are, and we lay down matting over 7,200 square foot, put some bathrooms in it, put our AstroTurf for our sleds. But it really took about 2 weeks of work to put it together. Once they understood that we're going to get this done and move it forward. What's beautiful is, like, we had the fall, we had a first try class, very large class, 144. This class was just on fire for the culture here. So they study all day together. They have classes. I go over at 5 o'clock to see our ParkerFit class, and half their class is over there exercising together, doing a ParkerFit class.
Awesome.
It's just total buy-in.
That is awesome.
Oh, heck yeah. And then also with it, by doing this, they come out, their eyes are becoming attuned to, oh, that's a faulty squat pattern. Oh, this person here they're doing this. They're swinging the kettlebell right here. You can see their shoulder. They got a protracted shoulder. They've lost their thoracic mobility. We adjust this, their shoulder motion improves. It's 4 years of developing a keen eye to what they need to look for in functional fitness. So they can walk out. If they do decide to have their own gym, they already have the expert eye.
Yeah. And really the great part is, I don't think there's another, when you develop that eye, there's no other profession on earth. And I'm saying this with respect to physical therapists. I don't think anybody can fix the problem you see as fast as chiropractic, especially in that functional fitness kind of realm. I mean,
oh no,
you're talking about dorsiflexion. I mean, literally the time it would take to if you were doing a, chiropractic manipulation for ankle dorsiflexion, that might be a literally 4-second treatment, right? And then get them right back out there and go, hey, can you do it now? Like, did that fix your squat pattern or at least help it?
Oh, you're exactly right. This goes back to Walter Reed. So I had a series of,
that's all your stories, huh? Dr. Morgan, all of them. This goes back to Walter Reed.
I'm sorry. They're not goes back. I got stories. Well, I'm not seeing patients here, but here's the thing. I've got people, I've treated, I can say with high level of confidence, I've treated more amputees than any other chiropractor in the world. But also I feel that I probably have prevented more amputations than any chiropractor in the world. We would have patients come to us. They have a blast injury. Their foot's injured. I had one in particular. His foot was fixated in an equinus deformation. Couldn't put his heel down. His dorsiflexion was negative 20 degrees. He couldn't bring it up past negative 20.
Wow.
He'd gone to 2 years of physical therapy. We're adjusting his foot. Within a few visits, he's up to positive 20 degrees dorsiflexion.
Damn.
He had scheduled an amputation of his foot because it wouldn't work. And we put him in the gait lab and show that it functioned normally. So, there's a great place for physical therapists. I work with them a lot, but stretching the gastroc is not all there is to dorsiflexion. A lot of times you do an adjustment and you can see the immediate effects right then.
Yeah.
And with that, you could have spinal subluxations you're dealing with all day long. They can't dorsiflex. Every time they do a squat, you're messing up their back. So, I'm a full body adjuster from the foot all the way up to C1.
That's awesome. Yeah. And it's great too, because it's when you have that quick feedback loop too, you go, hey, I'm going to adjust this ankle, and they stand back up. If things are still the same, either you're not a great adjuster, and I'm not saying you personally, Dr. Morgan, but I'm saying you got to realize, hey, either I'm not a great adjuster or I'm looking at the wrong thing. And if you can do that at lightning speed, your patients freaking love you, because you're not just saying, oh, it's better. It's not just your opinion. It's like, let's put a performance metric on this. Hey, how far down can I squat now? Am I better? Yes or no? And if it's yes, hey, the doctor is pretty damn good. I like this. I'm going to come back here.
Oh yeah.
Yeah.
And with the software that's out there now for recording stuff, you can record it, show pre and post adjustment right then. What's going on? But yeah, it's a great fit. Fitness and functional fitness and chiropractic. It's a match made in heaven.
Yeah, I love it. I love the fact that you guys are pushing the edge of the envelope there, and then we're going to get a bunch of students out there, because it used to be, I graduated 12 years ago, and I always say when I graduated, I was ART certified when I graduated, and it was an optional thing to have a soft tissue treatment. And now I think the kids that are graduating, I say kids, these young doctors that are graduating, it's no longer optional to have a soft tissue treatment modality. You have to have one to survive, right? And I think in another 5 years, it won't be optional to understand fitness and rehab. It'll just be part of what we consider to be chiropractic. And so I love the fact that you guys are pushing the profession forward in that way, because I think that's it's not just what we want as chiropractors, it's what our patients want from us as well.
Well, yeah, it really is. My philosophy of chiropractic is it's my job to remove the barrier to good health and performance. So if if their spine's not moving correctly, if there's a dysfunction in the spine that I have to adjust, if that restores normal function, I've removed the barrier. If they're obese or they've got a bad diet and I help them with that, or their exercises regimen is wrong, you're removing the barriers to good health, as opposed to the medical model, which uses interventions, medicines, injections, and surgery. They put something into you. We remove those barriers.
We'll be right back with our interview with Dr. Bill Morgan right after this.
Are you a chiropractor or physical therapist working long hours, worrying about lower repayments and missing out on quality time with your family? You can double your income without working more hours by adding a gym to your practice. Clinic Gym Hybrid Solutions has a step-by-step guide that dramatically simplifies and speeds up the addition of a fitness center and its monthly recurring revenue. In just 6 months, you can be on your way to freedom. Visit clinicgymhybrid.com today for a free downloadable PDF and complimentary consultation to get you started. That's clinicgymhybrid.com.
I want to kind of change gears a little bit here. I know we talked about ParkerFit and the work you're doing over there at Parker, but what I really love about you is you're the working man's president. You know, you're not an academic that never put hands on people. You've treated down at the quote unquote street level all the way up. What suggestions do you have for folks out there that want to get a vibrant, busy clinic so they could add a gym on? I know you talked a little bit before our interview about the 1,000 true fans, but can you kind of give everybody an idea what that means and elaborate a little bit?
There's an article came out, and the author escapes me right now, but 1,000 true fans is all you need for most people who have a creative business to live a very good lifestyle. Most chiropractors are always chasing, more new patients, more. Where when people come to you over the course of your career, they'll come to you for neuromusculoskeletal, musculoskeletal problems, and whether you're into wellness chiropractic, is it adjusting for wellness, or if you have a clinic that has exercise, what you're trying to do is help them get through their goals. If they come to you with back pain, and you tell them what we really need is lifetime chiropractic adjustments every week, they're not going to listen to you if you don't help their back pain. So it's your goal, it's your job to help them reach their goal. They have elbow pain, back pain. If you get them over that in 8 visits, do you think they're going to be happy? Of course they're going to be happy. So with that, if you can convert that person into a true fan, someone who sees you, comes in every 4 to 6 weeks, in the course of 3 to 5 years, if you pick up 300 of those or 600 or 1,000 of those, you pretty much have a full practice and you are having a very good lifestyle. With it, if you had someone who comes into you and they have shoulder problems and you help them, and okay, we've got you here. Now we'd like to put you on a fitness program in our gym here. It doesn't take too many, 150, 200, 300 patients who are now gym members and coming in for adjustments every month. And you've got a very healthy practice that does not rely on health insurance bureaucrats to make decisions for you.
Lovingly called bureaucrats, right?
Yes.
Yeah. So, and I always advise people, or I'm a huge advocate of adding on a gym, because it takes those out of those 1,000 true fans. If we can just get 100 of them or 250 of them, 25% of them to join a gym that you own, man, you're on easy street as far as revenue and income and whatnot. It's perfect. It's an absolute perfect thing.
It's a great fit. I've got former students who've rotated through Walter Reed with me and Bethesda, who have their own clinics, and they love it. And they've come out. We have the fittest person in chiropractic contest every year in October, along the time of our Dallas seminars. And I've had one of my former students, Michelle Groulier and her husband. They have their own gym, and just they're crushing it. They're having a blast. I'm watching them on Facebook. They're having fun with their practice. They're adjusting people. They're ensuring that these people are fit and living a vibrant, healthy lifestyle.
I'm sure you could. I'm sure you could speak to this, but I talk to people a lot of times about the energy that is added to your practice when you add a gym. But when you're at Walter Reed and you saw the people that if you could the people that participated in activities and exercise and the more aggressive, fun workouts, did you see a huge difference in the psychology of the clinic itself based on that?
Oh my goodness. If you went over to the MPD clinic at 7 a.m, they're playing with giant speakers playing rock music, and it is the pounding music, these guys are crushing it. These Marine soldiers, airmen, sailors, double amputees, dragging sleds, pulling chains. It's like, it was so bad. I don't want to use the euphemism that goes along with that, but very awesome to see the pushing each other and just going to the next level. That if you can do the heavy things in life, and what we wanted to do was show them, yeah, you lost your legs, but we got a bike ride across the country. You want to be part of that? Or we got a 100-mile bike ride in a couple of weeks to get ready for. When you take someone who's had a disability and you train them to overcome that, okay, the things that you wanted to do are now possible to you. What else you want to do? It helps their mental agility, their mental outlook on life to the level you just can't imagine.
Yeah, it's awesome. I mean, I always loved when I would come out of our treatment rooms and, you got somebody that's complaining about their shoulder pain or something coming out of the treatment room, and the best would be if it was a fit guy, mid-30s, mid-40s, and you open up the door and there's some 72-year-old grandma just, doing a kettlebell press with more weight than this guy can handle right now. And it's just like, it just sets expectations. You don't have to say it. You don't have to say a dang word. And they're like, oh, I get it now. And it's like, yep, you're going to be doing that soon. And I just love that effect, because you can't, there's no biofreeze you can apply or tape that you can apply that brings that awareness to their injury. It's like, hey man, that's reality. You got to get your stuff together and get going. And all of a sudden you see them kind of stand up straight and go, oh, okay, I guess we got some goals here. So I love that aspect of it. Yeah. So
I do too.
So being the fact that you're the working man's president here, that you've been in private practice, you've seen, heck, you've worked in government, you've worked in private side, you've worked every aspect you can. And what suggestions do you have for people moving forward in the profession? Like you're on the tip of the spear, baby. You're seeing all the changes. Where are we going, and what do you think people should be ready for in the next 10 years of chiropractic?
Well, it's a time of opportunity. And right now, you see how the world's going. It's a great dichotomy. What happened with the last election. The country's split in two, 49% to 51%. We're right at that level. The profession also. It used to be 15, 20 years ago. There'd be, I believe in this aspect of chiropractic, and somebody else would believe different. We would sit down and have lunch together. Wouldn't be a thing. But there's a lot of haters out there, and people promoting hate. To me, there's room for everybody. My suggestion would be, don't be a hater. If somebody practices different than you, that's okay. They're going to attract the patients that they need. Where's it going? I think functional fitness, functional neurology is our future. Neuroplasticity is something we need to really embrace and understand as chiropractors. If we truly are nerve doctors and not bone doctors, then we need to understand neurology. And I think, my opinion is functional neurology is a little bit hijacked. There's some stuff out there that's really good. There's other things not so good. I'd like for Parker to be a leader in functional neurology or clinical neurology, because functional neurology actually been maligned a little bit lately. Understanding that, and along with any type of neurology, strength and endurance are part of that. Your muscles cannot be separated from your nerves. And I think that's where the future is. And I want to make sure we make the best adjusters in the world. But like you said, we do need to have some soft tissue. We need to have a gentle technique, a manual technique, and a soft tissue technique.
I love it. Yeah. So along with that, I know that for those who are listening and maybe haven't looked at the offerings of Parker seminars lately, that certainly has gone through a change as the profession has changed as well. Can you talk a little bit about what's coming up for those people who maybe are, been in practice for a decade or so and really want to see some great speakers? What do you have to offer there?
Well, we've got a great lineup this year. So Jim Parker, who's legendary. When most of us, when we were younger, I've been in practice for 33 years. You learn how to be a chiropractor at your chiropractic college, and you learn how to run your practice at Parker seminars. That's our legacy. Jim Parker invented these ledger pegboard ledger billing systems, things that every chiropractor had back in the day. Well, things have changed. We're going into Parker 2.0. So chiropractors need the business acumen. So we have a business track so that in our seminars, so CAs and young doctors who need to understand the business, they can come and go through those tracks. We have philosophy instructors come. We have science-based instructors, technique instructors. So we're trying to have whatever that thing is you need to bring your practice to the next level, we have it there. In Las Vegas, we have 3 tracks. Our seminar here in Dallas, we have, I think, 7 tracks. And since it's harder and harder to get your technique, learn technique in chiropractic because of the legality of adjusting to somebody else's state, the malpractice. When we come to Dallas, I want to make sure we have, since I have hundreds of adjusting tables here, you want to learn technique, this is the place to come because we're going to teach you technique in Dallas. Vegas, world-class speakers. We have Danica Patrick, Rich Froning speaking. We have people who will teach you. We have at least 3 or 4 functional assessment instructors there. We have some philosophy instructors, history of chiropractic, neurology of civilization. It goes on and on. We try to have a big umbrella.
Yeah, you've got Dr. Greg Rose, who I'm a huge fan of.
Oh, yeah.
Teach with him in SFMA, but he's coming talking about surviving the golf swing. And I think that's a great, there's great business in the world of golf for chiropractors who want to get into sport. Danica Patrick, Rich Froning certainly knows what it's like to have a body that functions at the highest level. That guy's been a CrossFit champion more than anyone else in the history of the sport, correct?
Oh yeah, he was 4 times the overall champion. His first time he tried out, he didn't know what he was getting into. He just signed up for it, and he was dominating the competition. But he'd never climbed a rope before, so he came in second. But he's also won many times or several times the team competition. He's been going to a chiropractor every week since he was 12.
That's awesome.
So,
I mean, yeah, fantastic. Well, Dr. Morgan, we got to wrap this up, but man, I must say on behalf of chiropractic and on behalf of the world, thank you so much for what you're doing and what you continue to do, whether it's serving our veterans that are coming back with amputations and whatnot. I think you've done some great work there. You certainly did your best to promote the profession by bringing in young students and young chiros to see what was going on at Walter Reed in Bethesda. And I must say, I love what you're doing at Parker. So thank you on behalf of the profession, man. We owe you.
Thank you, Josh.
Yeah.
Thank you. Well, it's been a blast, and it's just so fun to be a chiropractor.
I got to say, before we wrap this up, I tell people all the time, there's never been a better time to be a chiropractor. A lot of people go, oh, the insurance repayments suck. Yeah, but they suck for everybody. I mean, there's not a single healthcare profession out there that's saying, oh, we're making great money and this and that. And if you can get past that, never have so many doors been open. Never has there been such great information and education about whatever you want to learn about. I don't care if it's pediatric extremity adjusting, or you want to learn about neurology or neuroplasticity, any of that. The world is freaking opening up for us, and it's amazing. And we have great universities like what you have and continuing education with the seminars. It's a fantastic profession. I'm very excited for it. So,
I'm optimistic as well.
Yeah. So thank you very much for what you've done for the profession. Thank you for what you continue to do. And if people want to get a hold of you or find out about your seminars or your offerings, or if they think they might be the fittest person in chiropractic, how should they find out about you or get a hold of you?
Bring it on. Parker.edu, go to our seminars, but it's in the first week of October this year. We're gonna have our competition, our throwdown. I'll be out there. I did it last year. It was one of the stupidest things I've ever done. Out there, Rich Froning yelling over my shoulder as I'm about ready to have a heart attack. But let's see, that's what I would recommend. Go to our website. We're going to announce the workout probably the next couple months and start training those strength, endurance, overall fitness.
Fantastic. Well, I love the fact that it was about the dumbest thing you've ever done. So you're back at it next October, right?
Yeah.
Yeah. Awesome. All right. Well, if anybody wants to hear more about Dr. Morgan's story, man, it's absolutely amazing. I could go on for hours about all the things you've done, but let's just say thank you to the president of Parker University, Dr. Morgan. Thank you for being with us today on Clinic Gym Radio. And all of those out there listening, go out there, maximize your license, and live the life you've dreamt of. So thank you very much, Dr. Morgan. It's been a pleasure.
Thanks for listening to Clinic Gym Radio. If you're ready to double your profit without working longer hours, please visit clinicgymhybrid.com and find out how easy it is to get started on your path to freedom. That's clinicgymhybrid.com.